Hi, I'm Dr. Jeffrey Tucker, and I want to share with you some of the exercises that I commonly use in my practice. And I always say to patients or to other doctors or practitioners, when I ask them, what's a good exercise? And really the answer to that is ones that our patients are going to do. So over time and a lot of experience, I want to share with you what I would consider some of the good exercises that I commonly use because patients will do them. And one of my favorite assessments actually has become something called a power pose. So I don't know if you're familiar with this or not, but there's a lot of research and evidence that shows that if you stand in this position, it's called a power pose. This is another power pose. And if you hold those positions for approximately 2 minutes, there's good evidence that shows it increases your testosterone and it lowers your cortisol. And that was done out of Columbia University, and there's a great TED Talk that you could look up, Power Poses, on TED Talks, and you'll see a 20-minute TED Talk that really explains it well. So how I've modified that with our CLX bands and for my patients, and I use it as an assessment as well as introducing the power pose, is I have them take the loops. This is our CLX loop. And I have them stand like this and try to hold that for 2 minutes. But more importantly, as soon as I ask my patient to raise their arms, that's an assessment. Could they raise their arms so that their arms are hiding their ears is one of the things I ask. And then do they have the ability to pull the band apart without breaking their posture? So I can look at their feet, I can look at their knees, see if their feet are externally rotated, they're neutral position, if their pelvis is in an anterior pelvic tilt or posterior pelvic tilt or neutral, or did they break in the thoracic region in the rib cage? So I want to make sure that all their checkpoints are well aligned. The feet are well rooted, the knees are soft, the pelvis is in neutral. I'm not allowing the ribs to flare. I'm holding them in so that my obliques are on. My arms are up and I'm pulling the band apart. And if I hold that for 2 minutes, it becomes a really great evaluation as well as something that the patients can do at home on their own that we call the power pose with the CLX band.